81. What is the priority nursing action for a patient with MI and a blood pressure of 90/60 mm Hg post-PCI? Answer: notify the provider and prepare for vasopressors. Rationale: hypotension post-PCI may indicate shock. Vasopressors and notification stabilize the patient, per AHA/ACC guidelines. 82. What should the nurse monitor in a patient receiving spironolactone post-MI? Answer: monitor for hyperkalemia and renal function. Rationale: spironolactone retains potassium and stresses kidneys. Monitoring prevents complications, per AHA heart failure guidelines. 83. What is the nurse's first action for a patient with MI showing frequent premature atrial contractions? Answer: notify the provider and assess for hypoxia. Rationale: PACs may indicate ischemia or hypoxia. Notification and assessment guide treatment, per AHA guidelines. 84. What should the nurse teach a patient about monitoring for complications post-MI? Answer: report chest pain and shortness of breath immediately. Rationale: these symptoms suggest reinfarction or heart failure, requiring urgent care, per AHA patient education guidelines. 85. What is the priority nursing action for a patient with MI and a new onset of jugular vein distension? Answer: notify the provider and assess for heart failure. Rationale: JVD indicates right heart failure. Notification and assessment guide treatment, per AHA heart failure guidelines. 86. What should the nurse do for a patient with MI and a history of hypertension? Answer: monitor blood pressure and educate on medication adherence. Rationale: hypertension increases reinfarction risk. Control reduces complications, per AHA guidelines. 87. What is the nurse's first action for a patient with MI showing ST elevation in leads I, AVL? Answer: notify the provider and prepare for PCI. Rationale: lateral STEMI, I, AVL, indicates circumflex occlusion, requiring urgent PCI, per AHA/ACC guidelines. 88. What should the nurse teach a patient about returning to work post-MI? Answer: consult the provider and start with reduced hours. Rationale: gradual return prevents cardiac strain, per AHA rehabilitation guidelines. 89. What is the priority nursing action for a patient with MI and a new onset of syncope? Answer: assess heart rhythm and notify the provider. Rationale: syncope may indicate arrhythmias or hypotension. Assessment and notification guide treatment, per AHA guidelines. 90. What should the nurse monitor in a patient receiving fondaparinux for MI? Answer: monitor for bleeding and renal function. Rationale: fondaparinux, an anticoagulant, risks bleeding and is renally cleared. Monitoring ensures safety, per AHA guidelines. 91. What is the nurse's first action for a patient with MI developing Dressler syndrome? Answer: administer prescribed corticosteroids and notify the provider. Rationale: Dressler syndrome causes post-MI pericarditis. Corticosteroids and notification manage inflammation, per AHA guidelines. 92. What should the nurse do for a patient with MI and a spouse concerned about recovery? Answer: provide education on recovery and refer to support groups. Rationale: education and support reduce family stress, improving outcomes, per AHA psychosocial guidelines. 93. What is the priority nursing action for a patient with MI and a heart rate of 110 BPM post-PCI? Answer: notify the provider and administer prescribed beta blockers. Rationale: tachycardia increases myocardial demand. Beta blockers and notification stabilize the heart, per AHA guidelines. 94. What should the nurse teach a patient about managing cholesterol post-MI? Answer: take statins as prescribed and monitor lipid levels. Rationale: statins reduce LDL, preventing reinfarction. Monitoring tracks progress, per AHA lipid guidelines. 95. What is the nurse's first action for a patient with MI showing new ST elevation post-PCI? Answer: notify the provider and prepare for repeat catheterization. Rationale: new ST elevation suggests restenosis. Catheterization and notification address occlusion, per AHA/ACC guidelines. 96. What should the nurse do for a patient with MI and a history of obesity? Answer. Refer to a dietitian and encourage weight loss. Rationale. Obesity increases cardiac strain. Weight loss reduces risk, per AHA secondary prevention guidelines. 97. What is the priority nursing action for a patient with MI and a new onset of crackles? Answer. Administer prescribed diuretics and notify the provider. Rationale. Crackles indicate pulmonary edema. Diuretics and notification manage heart failure, per AHA guidelines. 98. What should the nurse teach a patient about follow-up care post-MI? Answer. Attend cardiology appointments and monitor for symptoms. Rationale. Regular follow-up and symptom reporting prevent complications, per AHA post-MI guidelines. 99. What is the nurse's first action for a patient with MI showing second-degree heart block? Answer. Notify the provider and prepare for temporary pacing. Rationale. Second-degree block may progress, requiring pacing. Notification ensures intervention, per AHA/ACLS guidelines. 100. What should the nurse do for a patient with MI experiencing social isolation? Answer. Refer to support groups and provide emotional support. Rationale. Isolation worsens mental health, impacting recovery. Support improves outcomes, per AHA psychosocial guidelines. 101. What is the priority nursing action for a patient with MI experiencing recurrent chest pain post-thrombolytic therapy? Answer. Notify the provider and obtain a 12-lead ECG. Rationale. Recurrent pain post-thrombolytics suggests failed reperfusion or reinfarction. ECG and notification guide further intervention, per AHA/ACC guidelines. 102. What should the nurse monitor in a patient receiving amiodarone for MI-related arrhythmias? Answer. Monitor for bradycardia and pulmonary toxicity. Rationale. Amiodarone stabilizes rhythm but risks slowing the heart and lung damage. Monitoring ensures safety, per AHA arrhythmia guidelines. 103. What is the nurse's first action for a patient with MI showing ST elevation in leads V5, V6? Answer. Notify the provider and prepare for PCI. Rationale. Lateral STEMI, V5, V6, indicates circumflex artery occlusion, requiring urgent PCI, per AHA/ACC STEMI guidelines. 104. What should the nurse teach a patient about nitroglycerin use post-MI? Answer. Take up to 3 doses 5 minutes apart and store in a dark container. Rationale. Proper dosing relieves angina, and storage prevents degradation, per AHA anti-anginal therapy guidelines. 105. What is the priority nursing action for a patient with MI developing acute respiratory distress? Answer. Administer oxygen and notify the provider. Rationale. Respiratory distress may indicate pulmonary edema or embolism. Oxygen and notification ensure rapid intervention, per AHA heart failure guidelines. 106. What should the nurse assess in a patient with MI complaining of shoulder pain? Answer. Assess pain characteristics and obtain a 12-lead ECG. Rationale. Shoulder pain may indicate referred ischemic pain. ECG confirms MI, per AHA's symptom guidelines. 107. What is the nurse's first action for a patient with MI and a CCAMB level of 8% post-PCI? Answer. Continue telemetry monitoring and notify the provider. Rationale. Elevated CCAMB post-PCI suggests ongoing necrosis. Monitoring and notification detect complications, per AHA biomarker guidelines. 108. What should the nurse do for a patient with MI experiencing chills? Answer. Provide blankets and monitor for infection. Rationale. Chills may indicate fever or stress response. Warming and monitoring prevent complications, per AHA supportive care guidelines. 109. What is the priority nursing action for a patient with MI and a new onset of hypotension? Answer. Notify the provider and prepare for fluid administration. Rationale. Hypotension may indicate cardiogenic shock or medication effects. Fluids and notification stabilize the patient, per AHA/ACC guidelines. 110. What should the nurse include in discharge teaching for a patient with MI and heart failure? Answer: teach daily weight monitoring and diuretic adherence. Rationale: weight gain and diuretics manage fluid overload, preventing exacerbations, per AHA heart failure guidelines. 111. What is the nurse's first action for a patient with MI showing reciprocal ST depression on ECG? Answer: notify the provider and administer prescribed oxygen. Rationale: reciprocal changes confirm acute ischemia. Oxygen and notification guide treatment, per AHA ECG guidelines. 112. What should the nurse monitor in a patient receiving warfarin post-MI? Answer: monitor for bleeding and INR levels. Rationale: warfarin prevents clots but risks bleeding. INR ensures therapeutic dosing, per AHA anticoagulation guidelines. 113. What is the priority nursing action for a patient with MI and a new onset of peripheral edema? Answer: notify the provider and assess for heart failure. Rationale: edema suggests right heart failure. Notification and assessment guide treatment, per AHA heart failure guidelines. 114. What should the nurse do for a patient with MI and a history of GERD receiving clopidogrel? Answer: administer with a PPI and monitor for epigastric pain. Rationale: clopidogrel risks GI irritation. PPIs and monitoring reduce bleeding, per AHA antiplatelet guidelines. 115. What is the nurse's first action for a patient with MI developing supraventricular tachycardia? Answer: notify the provider and prepare for vagal maneuvers. Rationale: SVT increases myocardial demand. Vagal maneuvers and notification stabilize rhythm, per AHA arrhythmia guidelines. 116. What should the nurse teach a patient about managing hypertension post-MI? Answer: monitor blood pressure and adhere to antihypertensives. Rationale: hypertension strains the heart. Control reduces reinfarction risk, per AHA's secondary prevention guidelines. 117. What is the priority nursing action for a patient with MI and a blood glucose of 250 milligrams per deciliter? Answer: notify the provider and administer prescribed insulin. Rationale: hyperglycemia worsens myocardial damage. Insulin and notification stabilize glucose, per AHA guidelines. 118. What should the nurse monitor in a patient receiving tenecteplase for STEMI? Answer: monitor for bleeding and neurological changes. Rationale: tenecteplase, a thrombolytic, risks hemorrhage, including stroke. Monitoring ensures safety, per AHA/ACC guidelines. 119. What is the nurse's first action for a patient with MI showing widened QRS on ECG? Answer: notify the provider and check electrolyte levels. Rationale: widened QRS suggests conduction delay or hyperkalemia. Notification and testing guide treatment, per AHA guidelines. 120. What should the nurse do for a patient with MI experiencing guilt about lifestyle choices? Answer: provide emotional support and refer to counseling. Rationale: guilt impacts recovery. Support and counseling improve mental health, per AHA psychosocial guidelines.